Hello and welcome to the 27 Degree with Chris and Nancy. We'd like to welcome Dr. David Cunningham to our show today to discuss regenerative medicine. Before we begin our conversation, I'd like to thank our sponsor, Bay Coast Bank. Bay Coast Bank is just right for all of your financial needs. Visit baycoast.bank or call 508-678-7641 to learn more. So Dr. Cunningham, we are very pleased to have you here. Thank you very much.
Thanks for having me.
Yeah, this is going to be great. It's going to be a great topic to discuss. I'm sure many of our audience really has no idea what regenerative medicine is. So let's start by having you just tell us a little bit about yourself and how you got into this.
Sure, great question. I am trained as a family physician, board certified in family medicine, and I've been practicing in Massachusetts since 2003. In 2016, I started my own practice with one partner doing direct primary care. So a little bit outside of the insurance model, a little bit more time to get to root cause analysis for medical issues. And somewhere along the line in the first couple of years of what I was doing, I actually had a patient who had undergone a regenerative medicine procedure. And this was, and we can talk a little bit about the different things that we do with regenerative medicine, but this was for sexual health. It was for erectile dysfunction. Mm-hmm. And he said he loved the results, but he thought the experience was less than desirable. And he said to me, Dr. C, you really should think about adding this to your practice. You should look into it. Next thing you know, I was flying down to Miami to get trained by a company that I now consult with called Gainswave, and they do Shockwave for erectile dysfunction for men's health and now female sexual dysfunction as well. Wow. And honestly, that was my first taste of regenerative medicine. Mm-hmm. When I bought my first medical Shockwave machine, which is a radial pressure device. We could talk a little bit about the different technologies that are involved. I recognized right away that it was not a one-trick pony, that this approach, the concept of safe, effective stimulation of the body's natural healing mechanisms can be used for so many things. And I now give talks around the country and for various organizations and groups about sort of the head-to-toe approach that I take with regenerative medicine. A lot of physicians, a lot of practitioners in this space are limited. Either they're urologists doing sexual health, or maybe they're podiatrists doing a lot of foot and ankle, which is a big area of regenerative medicine in the U.S. But I'm very fortunate to have that head-to-toe spectrum, full spectrum of care that I can apply to these
being
technologies.
A primary care doctor really probably helped you to have a more kind of global view of the patient and really this topic. So
absolutely. Absolutely.
So because our audience, probably many of them have not heard about this field before, let's do a 10,000-foot view and just talk in general terms about what regenerative medicine really is.
Sure. There are a lot of definitions out there. I think the best way to think about regenerative medicine is the safe, effective, evidence-based utilization of some form of stimulation to improve the body's healing response. Examples of this are stem cells and platelet-rich plasma, which we often use in the orthopedic area, sometimes in aesthetics as well, and medical shockwave. Those are probably two of the more commonly known avenues of regenerative medicine. There are class 4 laser applications now, sort of something called photobiomodulation, warm, quote-unquote, warm laser that we use now. There are electromagnetic energy sources that we use now. We use not only radial pressure that I mentioned before, but something called focused shockwave, for which there's going on 40 plus years of study, all the way back to lithotripsy for kidney stone destruction back in the 70s and 80s, all the way now to doing intravascular shockwave during cardiothoracic surgery, not in the US, but in other countries for stimulation of angiogenesis. Mm-hmm. So I would say the major concept is that we're using safe technology or a safe application of some energy to stimulate a healing response in the body, rather than medication, surgery, steroid injections, therapy. Sometimes those are complementary to what we're doing, but the regenerative medicine approach is really relying on the body's innate healing response by stimulating it.
So I'm sure there are people out there who are listening. Sorry, Nancy. I'm not giving Nancy a chance here. I'm just
You'll both have a chance.
I'm so excited about this. tell us how it works, though. How does it stimulate? How does regenerative medicine, how do these techniques stimulate the body to heal?
So you're asking the magician?
Yeah.
Give up
give up the secret.
Give up the trick.
Let's hear it.
So the crazy thing, it's not magic, but
Okay.
there are, I will say, I'll be perfectly honest, there are aspects of what is happening that we don't fully understand.
Okay.
We can talk about the way we stimulate changes, and we can talk about some of those end results in terms of changes in cytokine expression, in terms of inflammatory, reduction in inflammatory and elevation of anti-inflammatory chemicals within the local environment. We could talk about platelet activation, but we don't always know exactly how we're getting to those responses within the body. But generally speaking, and it differs. I know I'm couching everything a little bit, but it differs from energy to energy. The approach is that we're stimulating the healing response often directly from platelet activation. So in the case of platelet-rich plasma, we draw off a portion of blood or a sample of blood anywhere from 8 to 60 cc's, depending on the indication. We will spin it down to separate out just the platelet-rich plasma component, and we'll re-inject that back into the area of concern. Sometimes we activate it a little bit beforehand with some calcium chloride or some other activation technique. But we know that platelets are so inherently potent as a healing stimulator. We think of them as clotting factors. We think of them as a scaffold for which we're creating a clot. But that scaffold formation is a very active process, and it's very biologically rich in some of the chemicals that start the healing cascade. With Shockwave, we're also stimulating some of the platelet activation with technology called EMTT, or electromagnetic transduction. We're actually creating a response called electroporation, and we're getting deep into the weeds now.
That's okay, though.
But what we're doing is we're really changing the polarity of our cells very, very briefly, and opening up ion-gated channels in the cell membrane to enhance the transport of material into the cell and waste products out of the cell, almost like hitting that reset button or that jumpstart button on the healing process in stagnant tissue. Laser is another area. High intensity class 4 photobiomodulation is something that I've recently included in my practice, and we're seeing very, very good results with it. Lots and lots of study, lots of evidence for it. And the way that works is certain wavelengths of light are stimulating the mitochondria, which are those little factories, those little
the energy source of the cell
in the cell, to create more ATP and increase the metabolism or the metabolic rate of those particular cells. And by doing so, not only are we jump-starting the metabolic processes within that cell, but those cells or those groups of cells are also creating the impetus for more blood flow to the area. So I tell patients all the time, when you think about watching the World Series, which just finished, 20 years ago, they'd be interviewing that starting pitcher or the closer in the locker room, and he would have 20 pounds of ice packed onto their shoulder, right? We don't do that anymore, right? Because we know that ice is, while it's going to reduce the inflammation, it's going to shut everything down. So the new model for doing this is class 4 laser. It's photobiomodulation. It's not flooding the area with blood and causing swelling, but it's creating that impetus from within to bring the blood flow selectively to tissues that need it. And so what you get is you get an increased healing response, you get increased recovery response, you get increased healing, you get significant pain relief just from those chemicals that are in that response from the blood flow. It's really amazing, all the intricacies of the response of the human body. And this is why I say there is, I was joking about the magician part, but there is some magic to it that even those of us who've been studying it for decades really don't fully understand.
But there's a lot in medicine that happens that we don't really understand, but the outcome, we know where it is. And, studies show that this may help. We don't always understand exactly how it works. We have a sense, but that's the way it is. Maybe in 100 years we will. But basically what we're doing is we're using the body to use its own healing process, but accelerate it in some manner.
Exactly.
So I have a question. So,
you want a question?
Yeah. I want to be involved in this conversation. So if to bring it down to like true examples for the people maybe that don't have any medical background that are listening to this. If say I'm a type 1 diabetic, I have chronic back pain and I need a knee replacement. Now, typically, if I go to one of my docs, I'm just not going to hear about regenerative medicine. So how does that conventional therapy, the pathway that I would probably follow, not knowing any of this, like how does this compare? Like, I have options, and
Sure.
I didn't know I had options before.
Yeah, I mean, there's a lot to unpack there.
Yeah.
Number one, it is true that a lot of physicians don't know that this exists. I didn't know. If I had not had that chance encounter with a patient who was willing to share his experience with erectile dysfunction and treating this, I might not be I probably wouldn't be sitting here talking to the two of you, and my career and my practice and my passion would not have taken the turn that it has taken. And I'm really glad, and I still see that patient and I still think of him in that way, and having really changed the direction of my career. And I really am thankful for that, because I think this is, for me as an optimist and somebody who believes in the power of the human body, this is huge. So I think it's a lot of lack of awareness that these things exist. There's a change going. There's definitely a sea change happening where people are much more aware. For better and for worse, a lot of that is through direct marketing. There are a lot of centers out there that are marketing directly to men with sexual dysfunction or directly to patients for PRP injections. I'm not here to judge. There are benefits and concerns about that sort of direct marketing, but at least we're getting the awareness out. And I think there's a core group of us that really are passionate about doing it the right way and making sure we're offering the right therapies. And so for that patient, that patient who has the arthritic knee and maybe has already had a cortisone injection, which we appreciate more and more might be doing more harm. I don't want to say does, but might be doing more harm than good over time, because it does seem to degenerate the cartilage. It has some short-term benefits. Nothing's evil in that. But if we're really talking about changing the course of that person's arthritis, it's not going to be through a cortisone injection. It's not going to be through a course of physical therapy, although that does help a lot of people. It's not going to be through typically arthroscopy, because again, what we're doing is just taking out diseased tissue. We're not rebuilding anything. And ultimately, we find that these individuals are on the glide path to surgery and end up with a knee replacement. So the question really comes in, where does regenerative medicine fit into that spectrum? I would love to see people initiate things like regenerative medicine sooner. I always talk about Winston Churchill's famous quote, "Americans will always do the right thing after exhausting all other opportunities and options."
That's so true.
Right? And it was true when he was saying it in a political frame, but it's true now as well. When patients come to me, unless they're my own primary care patients, but when patients come to me, oftentimes it's at the point where they're about to have surgery, or they're considering surgery, or they've been told they need to have,
And it's late at that point.
It's very late.
The benefits may be less at that
Exactly my point. And I will have a very honest conversation. I might be able to stave that off for a little while. I might be able to give them, and I'm pretty confident I can give them a degree of pain relief, but it is very hard to promise somebody that I can keep them out of the operating room.
I mean, if someone comes in, they have bone on bone in their knee, there's no cartilage left. It's hard for the body to repair that.
Correct.
But if they come in, they have mild arthritis or whatnot, that's probably where this can really make a big difference.
Absolutely.
And what's tough about that? Like someone could be walking around with pain and, know they're kind of like, oh, a couple more years, I'm going to have like a knee replacement probably. But they're like, I would be shy myself to like pull the trigger. Oh, I have a little bit of pain, I'll go check something out, because you're exactly 100% right. You're going to wait till that last minute when you're dying.
Well, I think that doing podcasts like this and being out there and talking to people hopefully will change that. Yeah. That's why I say I think there's good and bad in the direct marketing. Right. I think people need to know their options. I would love for people to be thinking about these things sooner in terms of what we're starting to think about in prehabilitation.
Right.
We know what rehabilitation means, but this new concept of prehabilitation. Just really quickly before we get off the knee issue, what's interesting is that there was a study done in Spain that showed that post-operative laser therapy within minutes of surgery, sometimes done in the operating room, sometimes done in the PACU, reduced opiate pain medication usage by nearly 2/3 in the post-op period.
Wow.
So even if you have that knee replacement, I tell all my patients, I would love to see you for a week or two before and 1 to 2 weeks after that surgery. It's not done when they close the sutures in the OR.
So in our local hospitals, is that an option that's available?
It's probably not in the U.S. at this point. I think a lot of it comes down to one of the things we'll probably talk later on about, which is insurance coverage, which is very lacking in the U.S., and also what is considered standard of care. So, we know some great surgeons who do great work.
Yeah.
It may just not be something that they're really able to introduce into their practice at this point.
It's interesting when I listen to this, everything you're saying about how you got into this. The parallel to, I'm into CBD, and that's a big interest of mine.
Of course,
It is so similar to what I experienced, and I don't want to make a sidetrack here, but I'll just throw this out there. So I got into that because there was a patient who came in to me and said, wow, I really got better with this stuff. And I've cut back on my opioids now and I feel better. And I thought it was crazy. I mean, CBD, who's it? So I started to look into it.
Right.
And what I've learned as a physician, I'm sure you're the same way, you have to have a bit of humility. You have to really listen to your patients because often they will bring forward ideas that aren't the mainstream in medicine. But if you really delve into it, they make sense, and sometimes 10 years down the road, they are the mainstream.
Yeah.
And some of the craziest ideas, like I'm sure 10 years ago, people thought CBD was insane, but we know it helps out patients. And this is a similar field, but similarly in CBD, it's like the Wild West out there. You've got people selling garbage, and there's people selling high quality products, and I think it's similar to what you were trying to say. In a way.
Yes.
And, I have people come in all the time. Hey, I bought some CBD at a gas station. Well, good luck with that. Let's see how that works out. Right. But there's a lot of people right now who are probably, a little unscrupulous in both of those fields. So you have to really be aligned with someone like yourself who really is doing it for the benefit of their patients and not just the financial aspect of it all.
Yeah. And I think, the history of medicine is littered with great ideas that then get, disproven. And so we do have to always be careful about those ends of one and this.
Yeah, we want to go back to the science, of course.
But the great thing is now, 10 years in with CBD, as you mentioned, and many years in with regenerative medicine of all types, there is a huge body of
the science
of evidence. Yeah. And it's not, a lot of this comes from outside the country, but I do talks about the research and most of the research every single year, and increasingly so, is actually coming from the U.S. So, which is great to see.
That is great to see.
It's not industry sponsored; it's institution sponsored. There's a doc down in Miami who does sort of all the best research on the use of focused shockwave or linear shockwave for ED. He's a urologist down there. There are people out, some of the biggest names in the field of urology and sexual health doing this. I was just at a conference 2 weeks ago talking about this, and it's really encouraging that we're having these conversations.
So, Dr. Cunningham, you seem like there's a broad spectrum where this can be applied. When you're looking at it in your practice, can you give us examples of where you've seen the biggest impact, and what's the ideal candidate like?
Sure. It's a challenging question because as a family doc, I see it all. And as I said, I give a talk called, Treating from Head to Toe.
So there's not like certain areas of usage where you're like, oh, wow, it's really across the board.
Yeah, it is really across the board. In my practice, sort of aches and pains of weekend warriors, I see a lot of strains, sprains. I see a lot of plantar fasciitis, Achilles tendonitis, patellar tendonitis, tennis elbow.
Can this be used? So it can be used with, can I tell you, I suffered for a whole year.
You know where I am.
That.
In fact, it's interesting. We're going to talk about insurance, but just as a quick aside, plantar fasciitis and Achilles tendinopathy are the two indications that have FDA approval in the U.S. with radial pressure because there is so much evidence. And that's why a lot of the initial adoption of regenerative medicine, particularly medical shockwave, is in podiatry, sports medicine. There's a gentleman at Spalding, Adam 1040, who is a specialist in this and sees high-end runners from all over the country and all over the world. It's right here in our backyard in very specialized areas and very specialized niche markets. One of my passions is men's health and sexual health. Yeah. And I've recently began working with a company that does female sexual dysfunction as well, and using the same technology in a safe way.
Can you give us an example? Like, what's the most common female sexual dysfunction that this is applied for?
Sure. So the two are incontinence.
Okay.
And vulvodynia or dyspareunia, basically pain during intercourse.
Okay. So
tightness of the muscles, discomfort, even atrophic vaginitis. As women age, they get thinner lining of the vaginal mucosa. And so one of the things we know about shockwave technology is that it does stimulate blood flow, increase blood flow through release of nitric oxide mediated responders. And so by doing these treatments, we actually increase blood flow. We can increase the normal lining, and we can vascularize some of this tissue over time. It takes some time, and it's not 100% for everybody. But I have an 82-year-old woman who I see for this treatment, and she's over the moon about it. Right? It's like everybody. We always have to define what success is for individuals, and be cautious about not promising that we can turn back the clock 20 years or turn them into turn that 60-year-old guy into a 22-year-old guy. But we can certainly start to moderate and reverse some of the degenerative processes.
I'm so excited to learn about this. Like, I'm in the medical field as a nurse, and I really knew like zilch, so to know that all this has been out there, and I didn't have to suffer for a year with my plantar fasciitis and wear ugly sneakers. This is like, oh my God, very excited.
Oh, I'm so glad. If I reach one person through this, really, honestly, then I've done my job, because I think we just need to be thinking outside the box. We need to be thinking about alternative ways that are safe. Again, it all has to be safe, right? So that's one of the things I love about this. Is the laser that I mentioned, there's a little bit of warmth, which actually feels good. Yeah. But I haven't had a single situation. I haven't even heard of a single situation in which there's been a negative outcome from this treatment. Right.
So it's not like the Austin Powers laser blowing up the moon type of thing.
I didn't say that.
These comments.
Freaking sharks with the freaking laser beams, right?
You were so Austin Powers.
No, he was ahead of his time. Dr. Evil wanted those freaking sharks with the freaking laser beams, and he knew what he was talking about.
Austin Powers was really about regenerative medicine.
I am not going to talk about Austin.
It was
Powers.
Subtle brainwashing. I have a very funny story I'll tell you off air about Austin Powers and a regenerative medicine situation.
That will be a story reserved for our patrons.
Okay, that's great. So talking about the different ways to implement regenerative medicine, you've talked about it a bit. So you've got shockwave, which is sound wave. I guess we can think about it that way in a manner.
Yes,
and vibration too.
There's some vibration. There's acoustic vibration or acoustic wave therapy.
Okay,
and then there's actual focused shockwave, and they're a little different in their potency and the way they're delivered. We sort of lump them in together for most indications.
And then you got laser.
Then we got laser.
And then you got plasma. Platelet-rich plasma. Platelet-rich plasma.
Yep.
I was getting that mixed up.
There you go.
Yeah, and then there's some other modalities too, but those are probably the three main ones that you're involved with, I'm thinking.
Yeah, well, the EMTT, the electromagnetic transduction, is the fourth one, and they all play nicely together, which is the other beautiful thing. The thing that I love, I call my superpower, is that synergy, putting things together. Not for that proprietary blend per se, but just to be able to have different tools to see that. Not everybody responds the same way, and not every body responds the same way. And just, we don't always know how you are going to respond to EMTT versus Nancy for, laser or so putting those things together in safe combinations is really effective as well.
So let me ask you this question. I'm sorry, Nancy, this is the last one.
I'm going to have to separate you two.
I'm just there's all these thoughts
No,
going
you're
in my
excited.
head.
I'm excited too. We'll just keep them here for hours.
Exactly. So TENS, for example, that's been used for many years for musculoskeletal conditions, and it does seem to help people out.
Yes.
Is part of how it helps through regenerative type modalities? I mean, I'm just wondering.
It's a good question. I will be honest, I don't know as much about TENS.
I just don't know if the electrical stimulation has anything to do with that.
My gut feeling is it probably does on a small level. It just may not be high enough. Forgive me, I'm not sure if we're talking about voltage or wattage there with the technology in the TENS units. But if you think about the fact that we've created a closed current and a closed circuit with the TENS, my suspicion is that the energy that can safely be applied through that current, through that circuit, may not be high enough to really create sort of stimulation of stem cells. But there's probably some. Yeah. It's also very, the other thing about TENS, and I think it's a great modality for many things, but it's very localized.
Yeah, it's very localized.
Right. So.
No, I just asked because, I've had TENS before, and when I asked, and I researched it, and you look to try to figure out why it works, and it's hard to know why it works, but it works.
Yes.
And I'm curious if it's a kind of an extension of what you're talking about, and it may or may not be.
Primacare is Southeastern New England's trusted leader in medical care. With offices in Fall River and surrounding communities, we're dedicated to your well-being. Our carefully selected team of more than 150 providers offers world-class primary and specialty medical care. Primacare doctors are supported by a skilled staff trained to deliver comprehensive radiology, imaging, and testing services. Primacare is large enough to take care of all your medical needs, but small enough to care for you personally. Primacare is by your side.
Can we talk about the different modalities you use and maybe some specific examples? And then, Nancy, I'm going to shut up and you can take over.
I would never want you to shut up.
Sure. So let's see. Let's start from the beginning. For me, the beginning was men's health and sexual dysfunction. And so for erectile dysfunction, which is extraordinarily common, and taking a step back for a second, I don't particularly care for the term erectile dysfunction as much as I like to talk about erectile function, because we know that over time it declines as vascular health hopefully slowly declines. Hopefully. Exactly. And even men in their 40s may have some degree of a decline in erectile function compared to when they were 20 or 30. So we know that it's a progressive condition involving a reduction in blood flow into the arteries of the penis, into the corpus cavernosa. And what we do with regenerative medicine typically is we're applying energy. In my case, I only use focused shockwave because I think it's the safer way and really where most of the studies are based. And the focused shockwaves help stimulate neurovascular regeneration. Okay. And what do I mean by that? I mean, as I mentioned before, nitric oxide gets released, increases blood flow. That improves the health of the vasculature within those areas of the penis that fill up with blood. And almost more importantly, the sensitive nerves that control that opening and closing of those blood vessels can improve as well. So that's a situation where we don't use laser, at least not yet. We don't typically use radial pressure, although some docs do. I'm much more in the camp of focused shockwave. But we do sometimes use platelet-rich plasma for some indications. It's a little controversial, to be honest, in the use of sexual health. But by doing that, we can create a stimulation for growth of neurovascular tissue. Now, that's widely different from what's going on in your foot, Nancy, with plantar fasciitis, where we have an irritation or microtrauma to the plantar fascia, and this connective tissue needs that healing response. So there we probably would use a combination of radial pressure, maybe laser to increase blood flow and that healing response from within the cells. We often do focused shockwave as well.
Typically, how long does that take to resolve? or is everyone so very different?
Everyone's pretty different. I generally say that the longer it's been going on, the more chronic it is, the longer it's going to take for that response to really kick in. So the more treatments you might need. But, sometimes I have people who come in 3 times and, for small joint, whether it's trigger finger or carpal tunnel or, a tennis elbow situation, and it's only been going on a little while, they might, after 3 sessions, twice a week, 3 times a week, once a week. Typically, we want to do it at least twice a week, by the way, just to get the healing response going. But that might be all they need. And I've had other people who, it was the 8th treatment that all of a sudden things started to move.
Now, is that something that's covered with insurance?
Unfortunately, it's very tricky. As I mentioned before, the plantar fasciitis and the Achilles, there's some coverage or there's some approval with the FDA. I do think that some of the docs I mentioned before up in Boston have been able to figure out how to get some of it covered by insurance. But most of us, do not take insurance for regenerative medicine just because there's really no active coverage, which is a shame. But
too bad.
Yeah.
But that's the way it always is with kind of newer types of modalities, and down the road it probably will be covered.
Yeah. It's tricky too because there are a lot of parties in this world of regenerative medicine that have a stake, so to speak, but there's no one Pfizer that could put up billions of dollars to get the blue pill covered through the FDA so that they can reap the financial benefits. And, nothing against them. They had to put up that money to get it through the FDA to get that coverage. There's no one entity in the U.S. in the world of regenerative medicine right now that can afford to do that, number one, or that would be able to then say, hey, that's ours every time you do that. That's a Storz Medical procedure that you're doing, right? You have to use this device and you have to pay, there's nobody owns that knowledge in the same way as, say, a pill.
It's just like frustrating though, isn't it? Like, with you have something that's like really proactive in a way, your own body's healing itself, and it's probably so much less expensive than the other options as you get down the line that we're so backwards sometimes.
Well, insurance reimbursement's a whole other topic, but it's, it is crazy the way things are reimbursed. I mean, we won't get into that too much, but
she did say she was going to steal me for a few hours, but that's what it would take, right? It is. It's interesting because we had a lot of conversation about that at this the Sexual Medicine Society conference a couple weeks ago, because there are academic centers doing this, and these are not-for-profit research institutions, and kudos to them for doing it and being able to say, we do need to charge you because we have to buy the equipment, but it's not about our business survival. Whereas my practice, it's a private practice. I don't take any insurance. I'm completely insurance free and have been from the beginning. So it is a bigger challenge to make sure people see the value. Yeah. But that's where education comes in. That's why I always like to get people in and see what it is, to feel what the technology feels like, to understand the experience, even for the outcome.
Let's talk about the experience, because I think that's important for people to understand. Let's talk about, for example, the erectile dysfunction. We'll start right there.
Great.
What is a man going to experience when he comes into you for treatment of that condition?
Sure. So, we always start with a conversation about what this gentleman might be going through, what they, maybe their medical history, of course, medications that might be causing some of these issues, if they've had any kind of trauma, both physically or psychologically, because, there is a fair amount of psychological, issue going on sometimes with erectile or sexual dysfunction.
So complicated.
Very complicated. And we'll do, generally a brief exam, but mostly what I care about is their history and maybe their medications. And then what I'm really interested in is what are their goals? I have men who come to me at age 40 and they've noticed the first signs of something. And they say, hell no, am I going to, pop this pill every single time that I'm going to be sexually active, right? And then I have an 89-year-old gentleman in my practice who is very satisfied that when he does take that pill, it now works again.
Yeah.
Right. So we have to really define what success means. And I'm very careful to make sure that people know I can turn the clock back a little bit, but I can't stop time.
Well,
Does it matter what the cause is? Like, say, a diabetic versus just someone who may be facing just normal, if you will,
Aging?
vascular. Yeah, aging.
It may, in that somebody with diabetes, number one, may have that sooner. And ironically, sometimes that makes it easier to treat because they're otherwise, they may be healthier in other ways, in terms of testosterone levels, in terms of other hormone levels and vascular, levels. But it definitely does matter. One of the bigger challenges I have to say is hypertensive patients who are on high doses of medications.
Right.
And sometimes it's the medications that are problematic. And do not anybody take this as a sign that they're supposed to go off their blood pressure medicines to be sexually active. But blood flow into the penis does depend on pressure in those arterioles. I tell men all the time, we think about, strokes and heart attacks happening more frequently in the morning.
Right.
But this is also when blood pressure and testosterone are highest. And that's also why men are often able to be sexually active more in the morning. Take that as you will. But that's the conversation that we'll have. And then we'll talk about expectations and what I think I can do in terms of working with them. And then the treatment itself, it's a medical procedure. So they're laying on my exam table and I'm using gloves and some ultrasound gel and applying the Shockwave probe directly to the shaft of the penis. It is comfortable. There's almost never any pain or discomfort.
That was my next question.
It's a great question. These technologies can be very uncomfortable when there's inflammation involved.
Okay.
But on healthy tissue,
Really?
it's fine. Right. If I noticed discomfort, I would be surprised in terms of the sexual dysfunction treatments. But the nice thing is it's a chance for us to get to know each other as well in terms of, there's a vulnerability when somebody comes into my office and is willing to have me do this procedure within, a short period of time of me first meeting them. But I'm a professional and I take that very seriously. And I always like to create an environment in which men feel comfortable. Number one, knowing that they're not alone. We see a lot of men with this. We know that this is a condition, a medical condition that men suffer with in silence, and don't suffer in silence, guys.
Right.
And that we can have a conversation about so much during the treatment that it's not this awkward silence where people are overthinking it, right? So I don't think I've had any patients, literally not one, who has not come back for their second treatment. So I pride myself on creating a comfortable environment.
How long does the treatment take?
About 15 to 20 minutes, depending on.
So you're basically you're kind of rubbing the probe over the corpus callosum,
and the crura,
area of blood flow. Okay.
Yep, absolutely. The crura, which are the areas of larger blood vessels in the pelvic floor that are coming into the penis, and then the perineum, because this actually can help with prostate issues and improve prostate flow and it's actually one of the things I think it's in the American Urologic Association, one of the pathways for treating chronic pelvic pain syndrome, in fact.
So you're helping with the blood flow issues, but there are a lot of men who also have a lot of sensation loss as they get older too. And it will help with some nerve regeneration also, it sounds like, although I would suspect that takes longer because nerves regenerate at a much slower rate.
Yes. I tell men, after the first treatment, you actually may notice a difference right away because we've released nitric oxide, we've stimulated blood vessels. You may have a great response. That may not be, permanent. Right. It may drop down a little bit before your next treatment, but they're going to get that response. Yeah. But they may not get that nerve-based response for some period of time because it does take longer, as you mentioned.
But it's such a spectrum, right, with erectile dysfunction. And, it's like you say, it's about expectations too, right? And there are some men who are very sensitive to the slightest change in their sexual function. And then, like you mentioned, there's the 70-year-old man who's just happy now that the Viagra works again. So it's interesting, but men don't have to wait till they're at that other end of the spectrum.
No.
In fact, it's probably better, I would think, that they achieve some type of treatment earlier on. Am I correct?
Yes. If there's one overriding theme that I try to get across to everybody is sooner is better than later when things are harder to reverse.
Yes.
Yeah. What about the general cost in this area? What does it range from?
It's crazy how wide a range it is. There are, I'm just going to talk in generalities.
Yes.
There are clinics that charge upwards of $5,000-$6,000 for a course of sexual health treatment.
Yeah.
It's a lot of money.
Yeah.
It is a lot
I
of
do
money.
not charge that much. I do charge a fair amount
Sure.
because it is very expensive equipment and a lot of my training, and I spend time teaching others how to do this. But I want men to feel comfortable with it. And what I've actually started doing, this is not about money or marketing, but I do offer a money-back guarantee after 2 treatments. So if somebody comes in and they do 2 treatments and they're just not
responsive
for them, or not even, I don't even go based on response. I go out based on, if you don't feel this is something you want to continue.
Oh, that's such a great
It's more about the
outlook.
experience, right? Exactly.
Look at you.
You know,
my
because I would love for
Yeah.
many, many more men to try this, to experience it, and
Right.
decide for themselves if it's something they
Right.
want to do. Because as I mentioned before, it's safe. There's no downside. There's no downtime. They can be sexually active immediately after. There's no numbing. There's no injections that we do.
Right.
There's nothing that would predispose them or preclude them from being sexually active immediately after.
How long do the treatments last for?
You mean the actual?
So you go through a series of treatments.
Oh, yeah.
Am I good for a year?
At least. I do recommend, if somebody has significant degenerative problems, hypertension, cholesterol,
Sure.
diabetes, maybe they're older, maybe they have some other vascular issues.
Yep.
Yeah, those are the guys that really should be coming back probably every 3 months or so for 1 or 2 treatments. But I have a whole number of guys in my practice who they'll, reach out after a year and just say, "Hey doc, you got time on Thursday?" Like, "Hey, yeah, sure. Where you been? Come on in." Right? You know where I am.
Mm-hmm.
So it's that sort of,
It's a nice relationship.
Yeah, it's a
It's
great
easy.
relationship. It's easy. Exactly.
Yeah. What about back pain? Can you talk a little bit about back pain? And
Sure.
are those treatments a little more painful, or like how do you?
Yeah, it's a great
what's that
question.
like?
So anytime there's pain or inflammation going on, the treatments themselves can be a little bit uncomfortable. But, it's not to the point where people, yell and scream. I always joke that I've got
Right.
soundproofing in my exam room so people can't hear them in the waiting room screaming. But that's not the case. It's generally well tolerated. What I do is a mix of different treatments depending on whether we're talking about discogenic, arthritic back pain, if there's musculoskeletal issues, muscular issues, soft tissue. It depends on really what's going on. I'll say, recently, for whatever reason, we've seen a whole number of patients with rotator cuff and upper back neck issues.
Right.
And that's a really nice condition for us to treat, because we can treat both with, I won't go into the details, but we can treat with a number of different modalities that treat both the inflammatory response that creates restriction of motion, like a adhesive capsulitis or a frozen shoulder, but we can also treat the muscle tightness that goes along with that.
So with the workforce being based more in home and everyone working on their computers, maybe not the great angles, and you get that pain.
Yeah,
like
tech
this
neck.
is kind of
Oh, yes.
tech neck. That's great.
Yes.
This is kind of a great little thing that you can.
Your head's like this the whole time.
Yeah.
Absolutely.
Not a good thing.
Absolutely. And in those situations, part of it's education, obviously.
Right.
Yeah.
Part of it's ergonomic adjustment, but also part of it is just getting them back on their way.
Right.
I'm not going to say to somebody, "Oh, you got to come in every 3 weeks for but let's see what we can do. We do deep tissue laser massage now with this machine that I mentioned, the laser machine, and it's therapeutic massage with that added bonus of the photobiomodulation.
Nice.
For things like tech neck. It's great. It's great. People walk out of there, we're primary care docs. We know that sometimes people walk out of our office not feeling great about whether they've gotten a new prescription or they've gotten a diagnosis or they're concerned about something. But I say, if you walk out of my regenerative medicine practice not feeling better about something we've done or something you're doing, then we've done something wrong, right?
Mm-hmm.
Everybody should be feeling more optimistic, more, just better about the way they're moving and the way that they're going to be healing.
So you've mentioned that you have a couple of patients in their 80s.
Yes.
So someone that's gone through the whole gamut with back pain and is maybe in later stages of life, do they have any hope with regenerative medicine? Or again, it's very individual, but it's worth a consult?
Yeah, it's definitely worth a consult. I'm very confident that I can give most of my patients pain relief.
Okay.
The real question I think that you're trying to get at is, can we reverse those changes?
Not so much reverse, because again, like people in their like 80s or 70s have learned to live with this pain for so often, but just giving them a little bit of relief more than what they're seeing in the pain clinics or if they're on opioids or whatever.
Yeah, I mean, if we can keep somebody moving, I mean, we know motion is lotion, right? We know that we should not let ourselves grow moss. Or I said, if you rest, you rust. Somebody told me this the other day.
Yeah, that's
I hadn't
true.
heard that before.
I like that.
But my goal is to keep people moving. And I think the nice thing is the partners that I have in the field of regenerative medicine in terms of the actual equipment, this is their passion as well. I mean, all the people I work with, most of them come from an athletic training or PT background or some form of physical medicine, approach where it's not just, hey, we're going to do this to you, boom, wave a couple of lights and a magic wand, and you're going to be 100%. But what we're going to allow you to do is continue to move and to continue to enjoy doing those things that you love to do with maybe a little less pain and more enjoyment. And we know that having something to look forward to is so huge.
Right. So there will be a little bit of pain associated with the back pain therapies because of the inflammation.
There can be, yeah.
Okay.
I wouldn't say there always is, but it depends on what we do. But yeah.
But we see that with a lot of treatments. Physical therapy can also cause some discomfort in the short term too.
Right.
So
I always, I have the experience where I'm using the focus Shockwave, and we'll have a conversation. As soon as I hit that area of inflammation, the conversation stops abruptly. So it's that sort of thing where they're like, "Ooh, you got it. That's the spot. That's the spot, doc." Yeah. But I always show that I always show my patients when I turn the machine off, the pain goes away immediately. Okay. So that's the nice thing. So even if it's a little bit of discomfort during the procedure, it's a mindset of not necessarily no pain, no gain, but it's a mindset of this is because that area is really irritated and inflamed. And as soon as we stop the treatment, that acute discomfort is going to go away.
Okay. So to see you, can they just call and say, hey, I have this problem, or is it a referral through their primary?
We have an open practice. So because I don't take insurance, there's no referrals necessary. I'm always happy to do phone consultations and what we call discovery calls to see if people are a good fit for what we have to offer. Right. I spend a lot of time on the phone just helping people understand what things are out there. And I always love doing that. Even if it's not something that we're going to work together on, I hope that I can give somebody some helpful information or at least direct them to the right person.
Dr. Cunningham, are you local?
Yes. So, our practice is in Mansfield. It's in Infinity Health and Body in Mansfield on Chauncey Street. Okay. So right near the center of town. So, right near the center of Mansfield itself. So we're close to major highways, and we have people come from
some great
all
shopping
over.
Up there too.
Yeah, there you go.
Especially before the Christmas season.
Shameless plug, but yes, absolutely. Yeah, so you can look on our website. You can give us a call.
And what's your website?
Yep. So it's www.infinityhealthandbody.com, all written out. And we're actually launching a brand new website next week. So we're sort of more focusing on our solutions-based approach. Nice. So much of this world gets fixated on the specific technology, and I always want to make sure that we're focusing on the patient and what their outcomes are, and how can I put together something that's going to be meaningful for them. So
Right.
Yeah. And then if they want to call us, it's 508-529-1395.
Can you say that one more time?
Yep, 508-529-1395. And they can actually, crazy enough, they can text that number. It's a HIPAA compliant text number. So
that's cool.
If patients want to say, hey, I heard you and just curious if we can talk for a few minutes, just make sure you give me your name and a way to contact you, and I'm happy to do so.
That's fabulous.
That's great.
And then as we kind of wrap up, what's the one thing you would like to leave our audience with?
I think probably the one thing.
Two.
All right.
We'll give you two.
All right. Well, so they're related. So one of the two things would be to ask questions about alternatives before before you do anything. Your physicians we're all well-meaning. We all went into this for the right reasons. We don't all have the same toolbox, right? So if you're seeing a physician who has something to offer and that's what they have to offer, they may not know about some of the other alternatives. So it's good to ask. It's good to explore. Number two, if you're interested in regenerative medicine, as we said before, sooner rather than later. Do not wait until you're scheduling that knee replacement before thinking about other alternatives. Let's see if we can stave that date off into the future or avoid it altogether.
That's great.
Thanks.
Do you have, as we wrap up, do you have like one great story you'd like to throw out there of a success story? I'm sure there are a number of them, but is there anything that comes to mind that it was really poignant to you and really stuck in your mind?
Sure. Trying to think of oh gosh, a lot of pressure to come up with that one poignant one. Oh goodness.
And he's already
tearjerker.
He's already shared like some great ones, with his
Yes.
No. So I'll say this. I have a patient of mine who I've known for many, many years. She's retired from school district where she worked in food service. And so she's worked with her hands for all of her life. She has a lot of arthritis in her shoulder. She walks with a cane, and she's got some hip and knee issues as well. In addition, she has metabolic disease, diabetes and heart disease. And she was seeing a surgeon about a trigger finger issue, actually involving 2 fingers on one of her hands. And he had recommended surgery, which, was a low risk surgery, but it's not a low risk, or it's not an easy surgery for somebody in this position. She's also taking care of a very sick husband at home. And I reached out to her when I got the consultation note. And it's a surgeon I work with very frequently and have a great relationship with. But I said, look, I would love to, before you schedule, see if there's something I can do. I'm not trying to steal business from this guy, but I want you to know that there's an alternative. And being very patient-centric, I'm not going to charge you anything. I want you to come in and see what I have to offer. And she came in, and we've done 3 treatments as of last week. And one of the fingers is completely better, and the other one is probably 70-80%. And my hope is that even if she does need to have that surgical procedure, again, we can help put it off. Right. Because she's dealing with so many other things. And the idea of her not being able to use that hand for her cane or to help take care of her husband right now is not really a feasible option. So even if I can't fix the issue, at least I can make it more tolerable and get her to a better place where she's ready to have that procedure done.
That's great.
Yeah. Thanks.
Can you believe we've been talking for about 45, 50 minutes on this? I mean, it went by so quickly.
See, I told you we could have spent a couple hours.
Oh, yeah. I mean, we could go on and on. I just
ordered pizza, so if we want to...
there's so many more questions and things we could talk about, but...
We can do a part 2.
We can maybe do a part 2 at some point. Yeah.
I would love to, especially if you hear back from anything in particular that your listeners want to talk about or want me to help.
It'd be great for anyone listening to this if you have questions to submit your questions to us, and then we could do a whole question series. I would love that. 15 questions or 20 questions.
It'd be great to see the equipment too, I mean, that could be part 2 also. Bring some of the equipment by.
Wait,
and
is it portable?
See what
some of it is. Generally speaking, it's very portable. Some of the things are not easily portable, but they're size-wise portable, which is great. Yeah. And like anything, every generation. I actually have a new device that I just got for sexual health, and the one that is being used by the professor at the researcher at the University of Miami, and the initial one looks like R2-D2. It's like a waist-high robot that comes in on wheels. And this 3rd generation that I just received yesterday to use is like a decent-sized microwave oven size. Wow. I mean, the technology's really become much more portable, much more.
That's great.
Movable.
And it will probably continue to advance as time goes on.
Hey, you might even be doing it at home soon. Don't try this at home yet.
Yeah,
but maybe someday.
Someday. Well, thank you so much.
Oh, my pleasure. Thank you for having me.
It was really wonderful to have you on the talk, on the show. I mean, it's such an interesting topic, and I was really excited to have you come along and discuss this. So thank you so much. And I also want to thank all of you out there for listening to our show. If you want to become a sponsor, please contact us at 774-319-4230. Special thanks to Ron John Gamache for our intro music, and the PC Institute for producing our show. Bay Coast Bank is just right for all of your financial needs. Visit baycoast.bank or call 508-678-7641 to learn more. Dr. Cunningham, thanks so much, and we hope to see you again in the future.
You name the day, and I'll love to
right.
be back. Thanks for having us.
Thanks, everyone, for watching, and we'll see you again in a couple of weeks.